Good morning, I'm Adam Sexton. This is normally the time of year when people travel from all over the country to reconnect with their families. But in a deadly pandemic, getting together for a big Thanksgiving dinner poses a unique risk to individuals and the community. Here this morning to discuss is Dr. Michael Calderwood from Dartmouth-Hitchcock. Thanks again for joining us, Doctor.
Thank you, Adam. Nice to be here.
So you're probably hearing this question nonstop, but what is the safest way to celebrate Thanksgiving this year?
So this is going to be a fairly unique year for the holiday, and we are seeing guidance that is continually changing as the numbers unfortunately go up. I think that the safest thing is really to only celebrate with your immediate family, so meaning those who live in the same household. We know that some are going to choose to celebrate with expanded family or friends. We can talk a little bit about how you might do that safely. But at this point, we want to limit travel, and particularly travel across state borders.
Yeah, let's get into that, how you do it safely. What if you want to have that small family gathering, but say grandma and grandpa there too?
So we have to think about those who are particularly at risk for having severe illness with COVID-19. And so individuals who are elderly are definitely more at risk, and particularly those who have certain comorbidities where they don't have as strong an immune system. And so I would give particular caution to thinking about not including some of these family members in indoor celebrations, particularly with large numbers. The risk is just too high. I would say that when we think about celebrations, outdoors is safer than indoors. The smaller number is safer than larger numbers. And as you bring people together, the use of masks in an indoor environment can mitigate some of the risk, as well as thinking about ventilation. And so a lot of people are thinking about windows and doors, which is difficult as the weather becomes colder.
What about the mental health aspect of this? So many people have been so good about staying home and being disciplined, and the allure of getting together to the holidays is going to be strong. Obviously, though, the mitigating factor is the immense dangers you talked about, is the spike that we're in right now. So how do you balance that obvious danger with the need for human connection?
So human connection is critical in this time, and we just need to think about ways in which we can do it. I've heard of individuals thinking about potlucks where each kind of member makes a part of a meal and then delivers it around to different households. So you're not necessarily congregating in the same household, but you are celebrating with a shared meal. Obviously, we've all gotten used to some of the social media platforms and the ability to do video conferencing between families. It's not the same, but it is something absolutely that can be used. And then there are other things that you can do, such as folks that said, well, I'm going to have an outdoor film festival where people are socially distanced and are kind of wearing masks when they can't be socially distanced. So there are things you can do. It's a time to think about unique and new traditions. It definitely will be a holiday that we remember and talk about for a long time. And you can make it positive. And I think we do need to focus on that. I think a lot of people are thinking about all the things that will be sad about this holiday. But we can actually make this a special time to be together with at least our immediate families.
The current pandemic curve that we're on right now, should New Hampshire be worried about the availability of ICU and hospital beds, say in December?
We most certainly should. And so we are seeing a rapid rise both in the number of cases in the community as well as cases in the hospital. And so we really continue with each week to set new records in terms of the new number of cases per day. So we first crossed 200, then 300, then 400, and we now have crossed into more than 500 cases in a single day. That was a number out from yesterday. Expectation after the holiday is we will be regularly seeing 500 to 1,000 new cases per day. We're obviously hoping that some of that can be lessened by people making different choices around holiday celebrations. And while we saw a delay in what we were expecting with hospitalizations, those numbers are now approaching where they were in the spring. So we now have over 100 individuals hospitalized throughout the state, and that is also going up at quite a rapid clip.
Governor Sununu's new mask mandate. If people adhere to this, when will New Hampshire start to see the benefit?
So we often see about a 2-week lag between some of these larger mandates and when we begin to see the impact. And that really has to do with the time between exposure and developing illness. But I think that this is particularly important as we go into a holiday season and really emphasizing we know that people are going to congregate, even if we talk about the risks of that. But masks do work, and we need to say to folks, when you are gathering with others in indoor environments or outdoors where you can't socially distance, that mask is really critical to the health of the community.
Do you worry that we're in some ways past the point of no return with mask wearing for a certain group of the population that is this very firm belief that it's not just not working for them, but some kind of an intrusion on their liberty?
I don't think we're past the point of no return. I think that we can look to other areas, and a lot of folks have been looking to the experience in Canada after their Thanksgiving celebration, and they hadn't put in as strict mitigation efforts around that holiday and saw huge numbers of infections and hospitalizations, including kind of some ICUs being overwhelmed. And we're trying to learn and do better as we go through our holiday. So I would not say we're past the point of no return, but it is a time to think that we could get there if we don't begin to make smart choices.
Let's talk a little bit about the COVID-19 vaccine that will hopefully start being rolled out here in the next month or so. First, hearing that Pfizer and Moderna are at efficacy rates of 95 and 90%. What does that mean to you as an expert?
I think that's really encouraging news. You know, we would have been happy to have seen efficacy rates of 70%. So the fact that we're hearing numbers that are 90 to 95% is incredibly encouraging. I would caution folks that these are early data, and they're really looking at the effectiveness in the vaccine at about a month time period out from when you receive the vaccine. We're beginning to get more long-term data, but what we don't know with this vaccine is how the immunity may wane over time. You can think about a flu vaccine where you get it once per year, both because it wears off and because the virus shifts from year to year. And so those are some of the things we still need to learn. I think we also have some things to learn about side effects. Right now, the data suggests that the vaccines are incredibly safe, and that's encouraging as we're beginning to look at those studies. But again, we haven't given the vaccine to hundreds of thousands of people. The trials are based on tens of thousands of people. And so as we start to vaccinate more and more people, we'll need to keep a close eye on that. But again, the early data are very encouraging.
What is the best way to administer the vaccine? The mind goes back to the images of the polio vaccine in the 50s, the kids lined up and all that. What works better? Is it something big, a big tent government effort, or surging these things out to a CVS and the local providers?
So I think it's going to be a mix of the two. I will say that this is an incredible effort by the government and local public health officials in coordination with hospitals and clinics and pharmacies. This is fairly unprecedented. You do mention polio, and we've done great things like this before, but the speed to which these are coming to market, manufactured and distributed out to those who need it is incredibly quick, and there are some logistical challenges in terms of how you store the vaccine, the fact that you need to get 2 doses. So there are large teams right now working on how to do this in the various phases. So I think that we will learn a lot in phase 1, people who begin to get the vaccine in December. And as we go out to larger populations in the later phases, exactly what you're talking about. How do we bring people into clinics, into tents, into pharmacies? There's a lot for us to learn.
Just as we discussed with the masks, obviously there's going to be probably a bit of a debate with some people wanting to take the vaccine or not wanting to take the vaccine. How many people need to take it to make it effective? Say if we only get to 70 or 80% of the population, will it fail?
No, actually, if we get to 70 or 80% of the population, that would be quite good. I think there's concern right now that there had been surveys really before we knew a lot about the vaccines. I'm hopeful as we're getting more data on both their efficacy and their safety that this number will be increased. But early on, about half the people that were asked were saying that they wouldn't get the vaccine. If only 50% of people are vaccinated, that likely is not going to be enough. But if we are approaching that 70% number that you said, we'd be in a much better spot.
Take us through timeline. If everything goes right from here on out, are we in the clear sometime in the middle of next year?
So, yes, I mean, the timeline is actually looking fairly encouraging. So Pfizer, as you know, just today submitted for emergency use authorization. The FDA is expected to kind of do a rapid review. The hope is Moderna will have a second vaccine that is coming out quickly behind that. And there are some other companies that also are developing vaccines. And so as we look through 2021, I think that we will have a good portion of the population that is vaccinated by next summer. It does not mean that everyone will be vaccinated, but we will be in a much better spot summer of 2021.
Obviously, a lot of time between now and then. What is your biggest worry as an expert, as a medical professional, about what could happen in the next couple of weeks and months?
So again, what we are seeing is the numbers even before the holidays are beginning to skyrocket everywhere. And while northern New England had been less hardly hit than some other areas, we are now seeing increases in New Hampshire, Vermont, Maine. And so I think we do need to be taking this seriously. We need to realize, as the governor did by saying we now have a mask mandate, that we all have a part to play in making sure that this spread does not get out of control and that our hospitals have beds to care for everyone that's coming in.
Dr. Michael Catherwood, we very much appreciate your expertise. We wish you a happy Thanksgiving and safety and good luck in the weeks ahead.
Thank you very much. Happy holidays to you as well.